Coming up
in your home with movies on demand. Spread facts, not fear. Join CNN for a global town hall, live Thursday at 8.
All right, I want to take something on with you because it matters. The president relies very heavily, and a lot of you have picked up this message and made it your own, that inside the coasts, America holds a very different and better reality when it comes to COVID. Now, look, the president's made a lot of currency off the politics of us versus them and the coast versus the middle states, the red versus the blue. That stuff doesn't stand up to the practicalities of a pandemic, okay? Inside the coasts, COVID is already there. 2/3 of rural counties around this country, our brothers and sisters, report at least one case. Now you say, oh, one case, who cares? Come on. It's never one and done. We haven't seen it anywhere. I know the president promised that early on. It wasn't true then. It hasn't been true anywhere at any time. The reality, Sioux Falls, South Dakota. An outbreak at the Smithfield pork plant threatens them now and an already strained food supply for the rest of the nation, okay? The mayor of Sioux Falls is Republican Paul TENHAKEN, and he's pushing for a stay-at-home order despite his governor's hard no. Mayor, welcome to prime time. Thank you for making the case. I'm sorry to meet you under these circumstances, but I want full information for the people where you live and beyond.
Yeah, Chris, you bet. Thanks for having me on, man. I appreciate it.
Pleasure is mine. So the governor says, looking up his rationales, listen, man, the balance of fairness here, the equities, we don't need to lock it down. We need to be conscientious. We need to look out for ourselves and how we're doing and take the appropriate steps. But we don't need to shut down like these other big states. Your response?
Well, I think there is some validity to our governor's approach. I need to lead by saying that. We are a state of 850,000 people, but in the Sioux Falls MSA, we're knocking on 300,000 people. So the density of our state is really in my two counties. So a blanket, shelter in place or stay-at-home order for our state does not make sense. And so I'm in agreement with our governor on that. What I am seeing, though, is based on the hotbed of cases that we're experiencing right now in our city. We have a doubling rate of every 4 days for about the past 18 days. So at that doubling rate, we need to act and we need to do more. And so I'm asking for more from the state, but in absence of that, we're going to do some things on the local level as well if we can.
Well, first, please feel free now and going forward to let us know what you need, so we can put out the word and it can be picked up by municipalities and states. Is there anything that you're dangerously short of right now in terms of capacity or coping mechanisms?
Our PPE, our hospital capacity right now it's a little bit of the calm before the storm, I'll be honest with you. I mean, I'm in touch with our healthcare providers on the regular, and we're kind of waiting for our surge. But our surge, we're in kind of the first inning of that, where, well, like I said, we've doubled every 4 days for the last 18 days. We now almost have 1,000 cases in South Dakota, but 800 of those are in Minnehaha and Lincoln County. That's where Sioux Falls is. So we're feeling the brunt of that right now in the southeast corner of the state. We're preparing for that surge, and we're also trying to do some enhanced mitigation strategies to try and flatten that, because right now it's not a curve, it's a spike, and we need to get on top of that.
So let's do this. After the interview, I'll make sure the producers give you my number. If you get in a PPE hole and you want to find fast resources, I'll help you network through New York State and some of the other high volume states to see what's out there in terms of gowns, masks, visors, gloves, and foot coverings. All those things will move in different ratios. We've seen it wildly move for different places and different percentages, which is weird, but we're here to help. Now, in terms of what you're seeing, oh, absolutely, Mayor. I mean, that's why we're doing this. If I can get you guys resources, we're all brothers and sisters in this. In terms of what you're seeing with the doubling of cases, what is it looking like on the ground? What kind of people are getting hit? What are you worried about?
Well, you alluded to it in your setup here that we have a large pork packing plant. I believe it's the third largest pork packing plant in the country that got hit hard and got hit quickly. And we have north of 400 of those 800 cases in our county are attributed to the employees of that pork plant. So having to stand up and ask one of your largest employers to close their doors for a period of time it's gut-wrenching, man. I mean, the effect on the people who work there, the economy, the upstream and downstream supply chain, it's pretty incredible right now. And so what we're seeing on the ground is almost two types of cases. We have the Smithfield outbreak, which we're dealing with separately almost, and then we have all the other cases that we're seeing grow in the community as well.
And look, it just keeps growing and expanding because, you know, to your earlier point, the governor's right. Right now, you don't need statewide coverage, but you're in the population center. And so you're going to have all this intercourse. You're going to have the trucks in and out on the roads, the people who come to work and go to visit other people, the food that gets delivered to other places and what's on the packaging. And the communication rate can be exponential, so you have to get it early. And Mr. Mayor, you let us know how to help, and we will. And you look young and healthy. I say God bless your family. I hope they haven't been touched by this yet, and I hope they don't get touched by it either.
Amen. Amen. Thanks, Chris. You keep getting better too, man. I appreciate the time.
Thank you. I'm one of the lucky ones. Mayor TENHAKEN, you'll get my number. We'll do it right now in the break. I'm a call away. I wish you the best.
Got it. Thank you, sir.
All right. What is normal? I don't know. I mean, it's been totally thrown upside down for me in my life. And when people get sick with this, I hear about so many humbling changes. But what does normal mean to you? Some closely studying this virus think that things may really change culturally for like a long time. What is this panic? What's the practicality? Is there a middle ground? They're all good questions. And we have somebody who is a top detective of diseases who's been looking at exactly this. Best new information and answers to the questions of normal. Next.
Join Anderson Cooper and Dr. Sanjay Gupta live for a new CNN Global Town Hall on the coronavirus pandemic.
We're determined to keep bringing you as much knowledge as...
It could be very own Giza Dream Sheets. Giza Dreams feature a beautiful silky sateen weave that helps keep...
She realized that she had to go to the doctor and get the test, and as it turns out, she had it, yeah. And she said that you helped her get through it by saying that you had to slay the virus or kill the beast or whatever it is, and they looked at your videos and you helped them. So you're on the...